Hello, everyone, and welcome to Shocker Family Connections. My name is Tia Hill. I'm Assistant Director in the Office of Student Involvement, and I'm here to welcome you to this week-long series. Most of you may be familiar with Shocker Family Weekend, which we traditionally do, and this is more of a safe and healthier version that we're bringing to you wherever you are. So we hope you're doing well. In the meantime, I'm going to kind of give you all some guidelines before we get started. This is interactive, and we do have an option for you to submit questions, whether that's in the Facebook feed or in the comment section of the YouTube. You will need to log into YouTube before you can submit those comments, so please do so. Our presentation should last about 15 to 20 minutes, and then after that, we'll do a question and answer session with our presenters. Make sure I don't have anything else to add. Let's see. If you're joining us for the first time, we did have this session at noon. These sessions will be every day throughout the week, Monday through Friday at noon and 6 p.m. So you have the option, and you can check out all of those links at wichita.edu/family weekend for more information. But as for right now, we'll go ahead and get started, and I will welcome you and welcome our first guest from Counseling and Prevention Services, Jessica Grossnicklaus.
Hello. So like Tia said, my name is Jessica Grossnicklaus. I'm one of the doctoral level clinicians here at CAPS, and I'm also our outreach coordinator. So I'm just going to give you some information about the services that we offer here at CAPS and kind of some options available. So the main service that we offer is individual therapy, and we want this to be accessible to every student and available to every student. So our main form is individual therapy, which is one-on-one meeting with one of our clinicians, our licensed clinicians. Currently, we're doing all sessions via Zoom for safety, so that won't be a concern. And therapy can address a lot of different things. Simple things is in terms of stress or time management, things like that, to anxiety, depression, trauma. We're trained in all of those things that can help with all of those things. In terms of payment, sessions are $10 a session. We want to make it affordable, so if $10 is not workable for your student, we can work with that to lower the cost so that it is accessible. And typically we offer sessions every other week. Sometimes we can do weekly sessions, but with the load of clients that we see, bi-weekly is more typical. To schedule an appointment for an individual therapy appointment, you can call us at the Wellness Center here. The number there is 316-978-4792. So in addition to individual therapy, we also offer some group therapy and some support groups. So for our group therapy, they're typically pretty small groups, so 5 to 10 students a group. And we have 2 different kinds of groups. So we offer our skills groups, which focus on things like stress management, distress tolerance, working through things like that. And then we have our process groups, which are a little more interpersonal, connecting with peers, talking about things that are going on in their lives, and discussing a range of concerns: depression, social anxiety, stress, interpersonal stuff. One of the great benefits of all of our groups are that groups are free and they meet every week, so they're a little bit more frequent, and then that financial burden is not there as well. In terms of scheduling for our groups, it's the same thing. Give us a call to schedule an appointment. Your student will first meet with one of our clinicians one-on-one to talk about what day and what time and kind of what their concerns are and what group might be a best fit for them, and then we'll get them connected with the right group. We also offer support groups, which are just a little bit different. Those are a chance to just connect with peers. They're a little more topic specific, so talking about specific things. These are also free, And to schedule for these, it's a little bit easier. We don't go through our scheduling service. These are just drop-in groups. Whenever you're available, you can hop on in. And then I will talk about our support groups, the ones that we're offering this fall. We offer a Keep Calm, Breathe Online, which is more of a guided meditation, relaxation. That is streamed on our Facebook page, actually, not Zoom, from Wednesdays from 1 to 1:30, led by one of our doctoral interns, Jessica. She goes through some meditation exercises, some mindfulness exercises to just follow along. Our Healing from Trauma support group is kind of just like it sounds, meeting with individuals who have gone through trauma, experienced trauma, and kind of providing support to those individuals. That group meets on Fridays via Zoom, and the information to RSVP is on there as well. And then we also offer a grad student group. So for those of our students who are in that higher education grad school, we offer a support group for them as well, and that is on Thursdays. We also offer some more emergency crisis services. So these are protected hours throughout the day, every day, for same day appointments. So these are for students where safety may be a concern, or hospitalization may be necessary, things like that. So we can provide counseling for that and provide some connection to some higher levels of care if necessary, like Calm Care, which is the crisis center here in Wichita, or one of the hospitals in the area as well. We can also get them connected with Care Team. I know Alicia is going to talk about that in a little bit, but we do offer those same day appointments if necessary. Some additional things that we do at CAPS, we offer assessment for ADHD and learning disability assessment. If that is something that your student is concerned about, having trouble in their classes, we can do assessment for that. We also do diagnostic clarification testing to figure out what diagnosis might be going on. So those are a little bit more expensive because of the test that we have to use. So that is $300 for approximately 3 to 5 sessions, depending on how quick we can get all of the testing done, but that is an option as well. And then we can help students get connected with Office of Disability Services if necessary because of that. We also offer some medication services. So mostly we can provide referrals to student health. And I know Heather is here and she can talk about that a little more too. We can refer students to student health to get medication for depression, anxiety, some other things. And then we also have an in-house psychiatrist that's here one afternoon every other week. And she helps with some of our more complex cases or for those who need ADHD medication. So that is also an option here at CAPS. Then kind of the last thing that we offer at CAPS is our prevention and outreach services, because we want to be able to connect with as many students as possible and offer our services and support wherever we can. So the big thing that we push at CAPS is our We Support You trainings. So this is something that we created, a brand we have created that has 4 different branches. So our suicide prevention branch, our substance abuse prevention, sexual violence prevention, and then overall mental wellness. So we have trainings available in each of these areas that are offered periodically and can also be requested that we'll give these presentations. So we also do requests for classes or organizations, things like that, to talk about any of the We Support You trainings or any topics that people are interested in: stress management, self-care, communication, lots of different things there. There's no charge for our outreach services, and we can do things after hours with our prevention stuff. So that is just kind of the whole spectrum of the services that we offer here at CAPS. And that is our information there. So we used to be located in Grace Wilkie. Now we are located in the Student Wellness Center, which is inside of the Steve Clark YMCA. We're also housed with Student Health. Our website is there that has this information and other things if you're interested in checking that out, as well as our social media. We post a lot of tips and tricks and resources available to students, so that is also another thing to check out. And I think that is it. Tia?
Awesome. Thank you, Jessica, so much. Up next, we have Alicia Newell, and she's going to be talking to us about the care team.
Hi, families. As you know, my name is Alicia Newell, and I have the privilege of serving as our Assistant Vice President for Student Affairs here at Wichita State. And one of my many roles is to chair our care team, which in essence, some people like to say, oh, she's the mom of campus. I happily accept that title. And when working with care team, the best way to describe it is that we are a team of individuals on campus who are on standby, ready to assist students when life isn't so kind. And so care team is a multidisciplinary team that provides wraparound services for students. And so we meet students where they're at and we get them to where they need to be. Our team consists of individuals from housing and residence life, from CAPS, from student health, our dean of students, student involvement, and student conduct, Office of Disability Services. And so it is truly a team that encompasses at any given moment, we're able to see who has a pulse on the student. When is the last time we've engaged and interacted with them? And this is really critical when we're looking at trying to help students through whatever issue or challenge it is that they may be going through or exhibiting at that time. When we talk about care team, a lot of times people think that the only time that they can refer a student to care team is if someone's in crisis, and that is not the case. Care team is utilized for a plethora of issues and concerns. And it's just that you just have to be concerned about somebody or yourself. And so it could be, I'm homesick. It could be my students coming home every weekend and they've not found their tribe of friends and they're not connected on campus. It could be signs and symptoms of isolation and depression, suicidal ideation, financial concerns, relationship concerns, issues of I'm not able to get my books because one of my parents got laid off from a job. Any number of things. I've been at the institution for 17 years now, and I am no longer surprised of the issues and challenges that our students go through. It's life. And the thing that I love most about our team is that we share a message of it's okay to not be okay. More importantly, knowing that there are individuals on campus who are on standby, available to assist them at any given time. Our data shows within care team within the last year, students who were submitted for concern, our number one population was our first year freshmen. Our number two population was our graduating seniors, and third was our graduate students. And so if we think about why students of these particular classifications are submitted for concern, you think of transition issues. Our first year students, parents, you can, empathize. You're going through that grieving process of having to let your student leave home for the first time. And then our seniors, they're so overwhelmed and what do I do next? What does that next move look like for me professionally? And so there's as college is great, it is exciting, but it's also overwhelming because there's a lot of unknowns, especially right now during a time of pandemic. And so knowing that Wichita State has a team on standby who's here to help. If anyone ever has a concern, they can go at any time, morning, noon, or night, to wichita.edu/care. And I'm going to say that again, wichita.edu/care. This, once you go to the website, you'll submit a concern, and that comes to the entire team. Once our team receives the report, within the business week, we are responding to it within 24 hours. If it's over the weekend, we'll respond on Monday right away. If it is someone who is an imminent crisis to themselves or others, don't waste time putting in a care report. Call 911 immediately, and then when time allows, put in a care report so that we can follow up. Overall, we're here really just to promote the mental health and well-being and social engagement of students, and making sure that they feel connected, they feel supported, and knowing that they can do this just with a little bit of support. That's Care Team in a nutshell. If you have any questions or concerns at any time, don't hesitate to reach out and contact us. We're here to support not only your students, but you as well. Thanks for tuning in. Tia?
Thank you, Alicia. Up next, we have Heather Stafford with Student Health Services.
Hi, everybody. Welcome to our session tonight. Yes, I'm Heather Stafford. I'm the Associate Director of Student Health, and I'm also a registered nurse. And I'm here to talk to you tonight about student health. And basically what it is just a doctor's office on campus that is specifically designed for college health and your students. We want you to know that we're here to take care of them. We're here to kind of keep a pulse on what the healthcare environment is going through. So that includes COVID right now. We're also here to make sure your students are staying healthy and in class. So when it comes to student health, we are located in the Steve Clark YMCA in the Student Wellness Center, along with counseling and prevention services. You just heard from Jessica. And what we do is really work together to make sure that students not only are staying physically healthy, but also mentally healthy. We want your students to come and see us because they pay student fees, and the services here are very, very affordable to accommodate for them being students and in a financial situation that it doesn't really help them if they have to go off campus and spend a lot of money to see a healthcare provider. A office visit is typically $30 to $35 for just a regular visit for illnesses. We see anything from ankle sprains to seeing people for flu, for strep throat, whatever it may be. And then we want your students to be able to also make appointments for preventative things. That would include physical exams for any health professions, or maybe the College of Education, they can do that, or maybe they're doing their well woman or well man visits and wanting to get on some type of contraception. So those visits are available, and those are a little bit of a higher cost than the normal office visit fee of $30 to $35. Then they might incur other services because we offer a wide variety of things. So we have a laboratory where we can draw lots of blood all day and send to our reference lab Quest. And then we have other laboratories that we have other services for. We also do some in-house lab testing, and that would be your rapid strep throat testing, rapid influenza testing, pregnancy tests, urine testing, and we also do COVID testing right now. And that is for our symptomatic students. We also have what we call an institutional drug room, which is our version of a pharmacy. And we have prescriptions here that we can give to your students so they don't have to go off campus to another pharmacy. We have antibiotics, we have antifungals, we have creams, we have like a Medrol dose pack for steroid treatments and different things like that. And we also have a wide variety of over-the-counter medications, and those are listed on our website because students don't necessarily have to see a provider to get access to those over-the-counter medications. And what typically we ask your students to do is maybe they just want to put them in request for their prescription refill, or maybe they want to get some over-the-counter medication. We have right now during COVID is curbside services, so they can just call in and order something, and we will bring it out to their car. And we could do that for prescription refills, over-the-counter medications. We do them with some of our other services as well, depending on what they need. And this is free to them to do the curbside service. So we really try and accommodate students. Right now during COVID, we are only allowing appointments, not a lot of walk-in care. We encourage students to wash their hands when they first walk in, put on a fresh mask. We don't allow any visitors in the facility right now to maintain a good, healthy environment for all the students. We do have a division in our clinic so that 6 students go down one hall and well student stand the other to make sure we're keeping a very sterile and disinfected atmosphere to where students feel comfortable either way. We want your students to be able to get in contact with us even if they have classes all day or maybe they're not even in Wichita. So through our patient portal, My Shocker Health, they can contact a healthcare provider and just ask a healthcare question. They may not know if they need an appointment or not, but that is also something that is accessible to them even when they're not on campus, or even if they're working all day as a returning adult student and don't have a lot of time to make healthcare appointments. They can still talk to a healthcare provider through the instant messaging in our patient portal, My Shocker Health. Some questions tend to be very personal in nature, so you can always go ahead and email us at the student.health@wichita.edu email. And a lot of our information can be found, including the online login for our My Shocker Health portal on our website, which is www.wichita.edu/shs. And Tia, I think we're ready for questions.
Thank you, Heather. I'm just going to add in here email personal health questions to student.health@wichita.edu. So I put that in the comment section so people can either click on it directly or they can copy and paste it based on their needs. So at this time, I want to open it up for questions. I know we took some questions through registration, and then if anybody else has questions, you can ask those in the live, either on Facebook or in the YouTube comment section. So one of our first questions we have, and then Heather, this is going to be for you, but somebody wanted to know, are free flu shots being offered on campus?
So we are expecting our flu vaccines to arrive sometime in October. We usually put out a campus statement to students through their My Shocker Blast email and let them know when the flu vaccines arrive. Flu vaccines are $20, but they are free with most health insurance plans. So if your student has health insurance, they just need to provide to us their health insurance card, and we will file that claim for the flu vaccine and make sure that that insurance hopefully gets everything covered at 100%. We don't offer it completely free anymore, and we do have a limited supply this year. We were not sure due to COVID how many students would be interested, because a lot of students are in online classes. So we do have a limited amount, and so they will be available here soon while supplies last.
Awesome, thank you, Heather. Alicia and Jessica, whoever is available, I brought this question up earlier, and I'm going to bring both of you in for this, but a person asked, let's see, my student lives on campus and it appears that their roommate seems down and has not been going to class. What can my student do to support their roommate?
Yeah, I think I would really encourage them just to try to have a conversation with them first. And see how they can help support them. But always working with their resident assistant, their RA in the resident hall first, or their resident life coordinator. There may be some additional information and things that they know about the student that's going on that could really elevate this to a care report or a direct referral to CAPS. If they notice that it's been a prolonged time of isolation, or additional signs of depression. And so I would really start there, but open communication I think is really key, just to start out.
Yeah, I would just echo what Alicia said, reaching out and kind of connect and see if there's support that your student can offer, or working with the RAs. Something that I mentioned in the earlier session was another thing that we offer here at CAPS is you can call to consult with one of our clinicians, not in an appointment or anything, just kind of over the phone if you have general questions like that. So if it escalates to something you're not quite sure what to do, you can definitely consult with us or submit a care report, like Alicia said, to help get your roommate, get the student connected where they need to be.
One thing that I'll add is a lot of times students are often reluctant to have these uncomfortable conversations, right? And this is where a lot of coaching and talking one-on-one with your student and coaching them through that process, or having them call our counseling and prevention services and talking with a counselor, calling care team, or working with their RA, because a lot of times peer-to-peer support is far more supportive sometimes than them getting thrown to us. And so making sure that students feel comfortable knowing that they don't have to have all the answers. They just need to know where to go for that support if and when it's needed.
Very good. Thank you all. So next question I have up here, it's a travel related question. We had a parent indicate that their student was afraid to travel when their grandparent passed away. So the question is, my student lives on campus, or no, that's a different question. In the event my child has to travel for a family obligation, what precautions should they take before, during, or after travel? Heather, I'm going to direct that to you.
Sure. And if your precautions are in reference to health related matters, then I would encourage you to, depending on where you're needing to go for the funeral arrangements, then I would kind of go use the cdc.org or .gov/travel website. And what that does is you can put in where you're going and you can kind of see the travel alerts that have to do with that area. So maybe there is more of a COVID situation there. It could list that, or maybe trying to make sure you're getting online and referencing that particular area and then seeing what's happening there with COVID or any other illnesses at the time. We're all looking at kind of flu season coming up, but it starts on the East and West Coast first and works their way in. So that's another thing to look at. But I would just make sure if you bring hand sanitizer, always wear a mask when you're in an airport, making sure you're trying to stay 6 feet away from people when you're in their airport area. Of course, you can't help that on the plane, but just making sure that you're, taking care of yourself and making sure you're monitoring yourself for symptoms before you get on the plane or before you travel. Making sure maybe you avoid large gatherings in a little bit before that time also. But, if you're going to be missing classes or anything like that, it's important to stay in contact with your instructors. If it's going to be an extended amount of time, I would suggest making a care team report through Alicia's reporting mechanism so that you have that support as well, and that your instructors are aware of a untimely leave that you might need to have to attend a funeral.
Very good. Thank you, Heather. Yeah, I just want to reiterate for folks, especially if you're have any concern about an incident that may impact your students' academic aspects, if it's going to impact their ability to perform in class, and if they're not getting responses from their instructors, then that's really what that care report is for. It can allow faculty or staff to be able to really help out with any of those incidents where you need follow-up, and the staff here are always happy to help with those. Let's see, another question we have, let's see. If a COVID vaccine becomes available, will that be offered free on campus? All right, Heather, that's you again. Oh, I'm going to unmute you. You got it?
That's my bad. We would hope that as soon as a vaccine is released by the government, that it will be accessible to everybody. From what we know right now, it will be 2 vaccines. You'll get one, and then a certain extent of time later, you'll get the second one. We hope to have as many as we can and be able to give them to students. As long as we can get them, we'll give them to everybody else. Now, whether it's free or not, we've seen in places where it's going to be free, but I would think we would just need to wait until that vaccine is released, and then we would try our best to get them to students and hopefully staff and faculty and everybody on campus as much as possible.
Thank you, Heather. All right, I have one other question. Jessica, this is going to go to you. You mentioned the support groups earlier. Could you be a little more specific in what some of those support groups are that exist on campus and how they could help someone's student?
Yeah, so the specific support groups that we're offering this fall, let me grab my little sheet here. So we have our Healing from Trauma support group. So what that is again, these are all over Zoom right now, is getting together with those who have also experienced trauma, and kind of talking about those things. We do different activities sometimes. Maybe we'll read an excerpt from a book, um, do different types of activities, and kind of talking about and providing support to one another, and kind of sharing those experiences. And then our other support group that we offer is our graduate student group. So that is just, again, another place for students in graduate school to get together to talk about, things that they're experiencing, struggles that they're going through, provide support to one another, maybe say, well, this is, these are things that I'm doing and I found this to be helpful, sharing in those experiences. So those are our two kind of traditional support groups right now. And those can be really helpful just because connecting with peers and knowing that you're not alone in some of the things that you're going through can be a really important step in healing and feeling better. So just having a place to connect with other students that are going through similar things can be really helpful. I will say our Keep Calm, Breathe Online group is a little bit different. It's not so much of a group where you are talking about things, but more following along and being guided through kind of some mindfulness types of things. So that one's a little bit different. You won't be like on the screen conversing with other students. That's more just following the stream along. But the other two, the grad support group and the Healing from Trauma group, that is you're discussing, you're conversing, and supporting your peers.
Very good. Thank you so much. So at this time, that concludes our session. I want to thank our presenters for taking the time out of their evening to talk to us about wellness as it relates to your students. We know that is important, and we take a lot of pride in ensuring that those students are getting everything that they need, whether that's physically, mentally, in their health. So we want to thank you for tuning in, and then remind you that tomorrow at noon and 6 p.m., as part of the Shocker Family Connection series, you can tune in again to learn from or hear from our staff in Housing and Residence Life about living and learning at Wichita State. So thanks again, and we hope that you join us again tomorrow. Bye, everybody.